So my name is Andres Lozano. I'm the chairman of the Division of Neurosurgery at the University of Toronto. And I'm interested in developing novel therapies to treat neurologic and psychiatric disorders. And the particular area of neurosurgery that I'm interested in is called functional neurosurgery, where we try to improve the function of the brain. So we've been using a technique called deep brain stimulation, which involves the placement of electrodes in the brain to chronically deliver, 24 hours a day, deliver electricity to brain circuits. Well, we've come to the realization that there are circuits in the brain that are malfunctioning in Alzheimer's disease. Alzheimer's is a huge problem with over 40 million people in the world suffering from this. And so we wanted to see whether one could intervene within the circuits of the brain that are affected by Alzheimer's disease to try to improve the function of these circuits in these brain areas that are affected, and to see if one could improve or restore memory in these patients. And so this has never been done before, but we've done really the first investigation of brain stimulation involving implanting electrodes in the brain. Well, the process is a long one from the first human being in the world treated, which was now about 6 years ago, all the way through a phase 1 clinical trial, through a phase 2 clinical trial that we've just completed. And the next phase will be a phase 3 clinical trial. So this will involve about 150 patients with Alzheimer's disease, and they will have electrodes implanted, and we will randomly assign them to either receive stimulation or not, and we will measure what the impact is of stimulation on their cognitive function. The goal is really to determine whether this kind of therapy is safe and whether it could provide some benefit in terms of lessening the cognitive burden, lessening the memory deficits, and perhaps slowing down the progress of the illness. And so this is really the next step, is to plan a larger, more thorough investigation of the possible role of deep brain stimulation in treating patients with Alzheimer's disease.